Hello, everybody. I'm WPTV anchor Chris Gilmore here for another live session. We're going to be asking a lot of questions from our viewers out there about the coronavirus crisis in India. We've been hearing a lot about it over our news headlines, and it's a global issue, a furthering of the pandemic. But we wanted to know how its impact reaches us here in South Florida. So there's actually a large Indian population here in South Florida, in Palm Beach County, and we tapped into those resources and found a really great organization here. It's the Female Indian Physicians of Florida, and we have one of their representatives here, one of their physicians, Dr. Sheila Shah, taking time during her lunch to speak with us about this crisis that's going on overseas and globally, really. Thank you for joining us, Dr. Shah.
Thank you. My pleasure. Thank you for having me.
Yeah, and as we introduce you, we want to also welcome all our viewers who are watching us over our live platforms on Facebook. Feel free to comment any questions you have for Dr. Shah. We want to first learn about FIPOF, Female Indian Physicians of Florida. What is the organization?
Okay, so that is FIPOF is the full form of it is Female Indian Physicians of Florida. This was started in 2018, and we started it, believe me, at my home. We decided that we females can contribute to society. And at that point, we had so many physicians from Palm Beach County join. We started growing. Dade and Broward also joined this organization. And now we have around 150 to 160 active members. All of them are physicians of different specialties and with highest accolades that you can think of.
Tell us about yourself. What is your specialty?
My specialty is internal medicine, and I have a practice in North Palm Beach, Florida.
Okay, and I guess it's self-explanatory then, Doctor. There is a pretty significant population of Indian Americans here in South Florida.
Yes, we have a large population here of Indians all over in Palm Beach County. We have a great, significant amount of people here.
And just jumping right into the issue, I've seen the headlines. We've heard about it on the news and in the newspapers. We're not out of the pandemic yet, but it's really bad in India. Just explain how bad right now.
Okay, so India is really, it has epic number of cases of coronavirus in India. And it was the big from April of this year to 2021, the second variant that really was people were caught off guard. You know what the problem was? India last year had difficulty. We had many cases. However, they put their guard down since the cases started to go down from September to February of this year. So people were, they felt like they are off the hook and the pandemic is coming to probably an end. The government had talked about a second variant that would be coming, but the government itself and also the population of India, the people of India kind of ignored that.
And Dr. Shah, sorry to interrupt, but a lot of people watching and these images that we're showing out of India right now think that this is the other side of the world. We're so far removed. But go ahead and answer those comments. How does this crisis overseas affect us here in Florida?
Well, we have such a significant population of Indians we have here. People have families back home and they feel helpless. They know people that their families are suffering and there is nothing they can do right now, physically go there to help them. So what we are requesting is that people can help us donate something so we can send them what is needed right now in India to help people and mankind there.
I've been following the story as I've been researching this, and we're seeing oxygen tanks right now being wheeled into makeshift hospitals and pop-up clinics. Those are obviously one of the things that are needed by a lot of the people there. But what are some of the things that those donations are going to go towards to FIPOF?
Okay. So I'm glad you asked me that. The donations from FIPOF are definitely going to go, one, for the oxygen cylinders and the concentrators that are badly needed there. They will go for ventilators that is needed, that are so badly needed there. That will go for vaccines, so that people who cannot afford to get a vaccine, this we will fund them so that they can get their vaccines. There are so many poor people. They don't have food to eat. They can't work. This money will help them to at least put some food on their table.
So
So
a lot of people who are choosing between putting food on the table or treating themselves.
correct. So they are. I mean, it is such a terrible situation there that we really need to. That's the reason our organization wants to help out the people there, and especially the poor people, because they are the ones who are suffering the most there.
And we're seeing a lot of support in the comment sections from Julie and Billy and Maggie, all sending their support. This is, as I mentioned, a global issue, but it has direct impacts here in South Florida. And we were talking before the chat, Dr. Sheila. You said that you have family right now in India who are battling this virus.
Yes, I have a sister-in-law, my brother's wife, and his son, and my nephews who are going through this crisis. Thank God that they are okay, that they don't need to go to the hospital because their oxygen saturations are okay, and I'm able to treat them sitting from here. Because if I you know we, because of the total meltdown of the medical system there, people cannot reach to doctors are overwhelmed. It's not that the doctors there don't want to help, but they are just overwhelmed because of the epic proportions of cases coming. Doctors are getting burnt out, fatigue. So that is the reason we decided that even our female physicians will get together, and we have formed a group where we talk to patients directly there, one on one, guiding them what to do, what not to do. People are panicking. Should I go to the hospital? Should I not go to the hospital? And so we are guiding them if they really need to go to the hospital, or they can be treated from home, self isolate themselves. So this is we are also contributing our time and our efforts to help them.
Yes, Dr. Shah. Now we have an interesting question at this point from Maggie. What can we do to help? That's the reason why we're here today, learning about your organization, Female Indian Physicians of Florida. That's just one, I'm sure, of many here in South Florida. But that's a great start you were telling us in terms of how we can directly make an impact to help what's going on in India.
So right now, what we need is some help for our people, and every dollar counts. So if even a small contribution given to our association, we directly send it to India, and we make sure that it goes to the right people, and it reaches the people there, and they get the help that they are looking for.
And Dr. Shah, you were mentioning that there's a lot of people over there who are suffering from COVID-19 who don't have access to, medical care or insurance, and you're having to, outside of your regular practice, do these virtual calls and visits. How many of that kind of stuff are you doing, and how many other physicians in the group are doing the same?
Oh, there are several physicians who are doing in the group, and I mean, I can speak for myself. I do at least 20 to 30 visits a day. People call me up, I talk to them on Zoom, give them my advice, they show me their results, and I guide them what needs to be done. And many of my female colleagues from this organization are doing that, and I sincerely thank them for that.
And this is free of charge, I'm assuming?
Yeah, this is free of charge. We do not get a penny. This is the least we can do to help our homeland and our people there.
Wow. And one other thing I'm seeing in the comments here from Lori, vaccines are free. I know in other countries they've chosen to sell the vaccine. That there is several vaccine manufacturing plants in India. Looking at the numbers, though, from what I saw from outlets like the BBC, 2% of the Indian population is completely vaccinated. What's the disconnect there, Dr. Shah?
The disconnect is that, yes, there is only health ministry says 6%. So 2 to 6% of the people are vaccinated. Again, when the surge was down in January, Indian government decided to send its own vaccines to different countries. They sent the vaccines to Canada, they sent vaccines to Brazil, because they did not anticipate that the surge is going to be this bad and that their own people will need those vaccines. So that was a little, there was something that Indian government could have handled it better. They sent out oxygen to different countries. 700% increase of oxygen that was sent to different countries in January. And look where they are today, suffering, wanting oxygen back for their own people.
Yeah. So now the country's looking for the same help that they were giving at this last year. Getting an interesting question from Julie, asking what messages could we be telling our loved ones over in India about how they can protect themselves? They're finding themselves in the same situation our country was this time last year.
And again, I will tell, and I keep telling my people there, please don't get out of the house if you don't have to. Stay indoor. If you have to step out of the house, do not leave without wearing a mask, double mask, because the new variant is extremely bad, and it is affecting young people, so they need to stay home. They have to ride this terrible wave for the next 4 weeks. They have to be responsible. The people have to be responsible also, and follow the guidelines.
Okay, and what would you tell people who want to fly there or fly loved ones here? Is that recommended, or what's your expert opinion there?
I mean, at this point, I do not think anybody from India should be coming to the United States, or anybody from United States should be going to India. I mean, it is an epic crisis, and we do not want to, I wouldn't want myself or my family members here to be going there, because the chances of me or my family getting infected would be very high. So right now, stay put where you are and just take care of yourself.
It's just wild how it seems like the process is repeating itself, because I'm having flashbacks to the travel bans from last year. We saw all the high infection rates over in China, and we thought here as Americans, oh, it would never reach us. And I'm sure there's a lot of people who are thinking the same about the Indian strain that we're seeing. How easily can that jump across the continent, across the ocean here to us?
Absolutely. And we do not want that. We had enough of the UK variant. We don't want this variant again to spread here in United States. So best is to no travel at this point.
Okay, we're getting a question from Devi asking how to cope with the feelings of helplessness and anxiety, especially when healthcare and medical attention is such at a premium in India right now. How do you deal with the feeling that you may not get that medical attention that you need?
Yeah, so the medical attention you don't get, that is true. So that is the reason people like myself, for physicians who are willing to help out, do anything, talk to them, counsel them. Anxiety and fatigue, it has set in so much, and we can contribute by just giving our helping hand to them. Sometimes, listening to us and talking to us, it eases their anxiety. And I've been doing this for several days, and I know how good they feel when they hear from a doctor from America or other countries who are willing to help them.
And doctor, I got to ask you this, because I know you've been doing this for years professionally, and you definitely have a great bedside manner, I'm sure. But it's all fine and good until it happens to somebody that you know who gets diagnosed with this terrible virus. I'm sure you've been feeling very emotional about what's been going on with your family, and a little bit helpless, because I'm sure your instinct normally as a human is to want to fly over there and help, but you mentioned that that's not really an option right now.
No, that's not an option, because I want to help, but I can go and get infected there. Once I get infected there, am I going to be able to help? No. So this is my time is from here to help out as much as I can.
Okay, I want to pop up because I know that people are wondering how they can help. We're talking about it, but there are ways that you can directly impact. So let's pop up the website for your organization, the Female Indian Physicians of Florida. There's links there to how you can help. You guys are a nonprofit organization,
Yes.
pretty wide reach, and it's pretty awesome that there's so much female empowerment going on here. Just tell us about some of the other ways that people can help. I know that you aren't the only organization doing similar things right now in South Florida.
Yeah, I mean, I'm right now, because I'm so heavily involved with my organization, so I am focusing on that. But there are organizations in Fort Lauderdale that they can also reach out to. And
I've heard of, for example, the American Association of Physicians of Indian
yes,
Origin.
so that is our national organization, American Association of Physicians of Indian Origin. It has 60,000 members in there, and they are doing a tremendous job right now helping out people. So people can even go to aapi.org, and they can contribute. They can even donate there. So they can donate to me, to my organization, FIPOF, or to AAPI. I would be so grateful to everybody who can donate, because at this point, every dollar counts. And I want people to know that your $1 can possibly save a life there.
Mm-hmm. And just go ahead and see if we can navigate your guys' website. Where do we go on your website to go ahead and donate?
Okay, so there should be a link that would take you for donations, and if I don't have it, then please they can email us at fipof2018@gmail.com, and we can guide them to how to donate. And there are some of the ways how they can donate to this.
Yeah, we just highlighted that email address there on the screen, and you also have secure PayPal, Zelle, and Venmo, and that will all be going to the relief effort over in India right now. What else have you been monitoring in terms of what's going on there nationally in India? They're dealing with a new strain of the virus. How easily can that mutate, the coronavirus?
Because the new strains, they really mutate very fast. They just and it affects the younger population. Right now the strain is B1167, I think, which is just mutating at a rate, it's phenomenally mutating crazily. And the problem with this new strain is also some people, they are getting tested and it is testing negative, but they have every symptom of COVID. So that because the testing has broken down, so I don't think even the testing they do there is really reliable, because people are so sick. I have people who call me that their COVID testing was negative, but their labs, their oxygen saturations are so bad that if they would have been in United States, they would be in an intensive care unit on a ventilator.
So trust your gut feeling.
Just your gut feeling. And again, I tell my people in India, don't go to the hospitals if you don't have to, because the situation is so bad. If you can treat yourself at home by isolating yourself, if your oxygen saturations are stable, that's the best thing you can do for yourself.
Okay, I can tell that this is a topic very close to your heart. Just out of curiosity, obviously technology has been our best friend here during this pandemic. We've been able to, as you mentioned, have all these one-on-one virtual conferences and meetings with your loved ones and patients who you're now having to treat overseas. But for your friends, family, and loved ones, what do you tell them just as a family member in terms of sticking through this and just being smart?
I have been telling them, this is a bad wave, it shall pass. Pray, have happy thoughts. Don't watch the news too much, because sometimes that is in it itself is so depressing. Happy thoughts, easy said than done. but these are the advices I've been giving people there. Just, take deep breaths, exercise, do the things, for yourself, and stop, because what's meant to be will be, but you can do your share of staying home and taking care of yourself and your loved ones.
And we know how very real the coronavirus is. It's at the point now where if you haven't had it yourself, even here in the U.S., you know somebody who was affected by it. Is it pretty much the same among your Indian physician peers, doctor, who are similarly having to do virtual teleconferences with their loved ones who are fighting the virus as well?
Oh yes, definitely. So they are doing these virtual things to help their people there.
Okay, and you said one of the many things that your dollars are going to go towards as donations are going to be towards those oxygen cylinders that we saw. We have people who are struggling to breathe,
They
so
are struggling, and their oxygen saturations are in the 80s, low 80s. They get to the hospital, there is no oxygen. When there's no oxygen available, human body cannot survive without oxygen. And then they just die. It's just so heartbreaking that a person cannot get oxygen. I mean, simple thing of life, killing people. When I look at those scenes, believe me, I break down and cry. When every night I go to sleep, I just, I can't sleep. I'm starting to get nightmares looking at all the things that I see on TV. And I've been a physician for the last 30 years. I can take a lot of pain, but this is just unbearable pain.
so now you're focusing on just how you can help.
Yes.
Some of the just nightmarish images we're seeing out there, funeral pyres for people who, even the mortuaries and morgues are completely filled. So you're seeing bodies being burned in the street. So
Correct. Because
very sad, apocalyptic type stuff.
I mean, it would break your heart to just look at that scene. But not only that, they're piling up bodies one over the other to cremate them anymore, because they just don't know how else to take care of this. They are burying people one on top of the other there, because they just don't know how to handle this crisis anymore.
Mm-hmm. And the thing to focus on is exactly what you're doing right now, Doctor, mobilizing the talent and the kindness that we have here in South Florida and shipping it overseas. We have a lot of specialists here in the comment section. I see Dr. Gopalan here, who we've spoken to pretty frequently here at WPTV, an infectious disease doctor here in Palm Beach County. I'm sure keeping very close tabs on the situation too. How important is it for you now, Dr. Shah, to just focus on, as I mentioned, the relief efforts as opposed to, the negative side of things, what's going on there?
Yeah, I don't want to think of the negative side. I want to think of all the positive. I want to reach out to all my fellow physicians here in Florida and across United States to step up to the plate and help people. Because it is going to be couple months are going to be very bad, but we need to be there holding their hands and helping them through this terrible crisis.
Okay, so here's your call to action, South Florida, or anyone else who is watching. If you can help, send your well wishes, or just let people know that you care. Even if it's not $1, letting them know that your thoughts are with them is sometimes enough.
Absolutely. And even if they cannot give $1, even if they can talk to a human being there over the phone and give them that little support, that would also go a long way. Sometimes a helping hand, a friendly voice really goes a long way. Somebody to tell you it is going to be okay.
Okay, we can only hope. Thank you so much, Dr. Shah, for joining us. Thank you, everyone who's watching on our live stream. We gave you lots of options on how you can help. We're going to post this on our Facebook page, so you can go ahead and play this back and find all the resources. But Female Indian Physicians of Florida, FIPOF, is Dr. Shah's organization, a great place to go if you're looking to send some immediate help overseas to India. Thank you so much for joining us, Doctor.
My pleasure. Thank you very much.
All right, and to all you watching, take care and have a great day.